My name is Dr. Wan Syazli. I am a plastic, reconstructive, burns and aesthetic surgeon in Avisena Specialist Hospital in Shah Alam. Okay, when you talk about burn injuries, usually we look into two aspects. First is the demographic of burns in terms of the age of the population involved. Number two is the type of burn agents that cause the burn injuries. So in terms of the demographic or the population distribution of burn patient, we can divide it into two types. First is the adult population. Number two is the child or pediatric population. And most of the cases that we see in hospitals that require admission is just less than 5% of all the cases that came to the hospital. Mostly 90% can be discharged and treated as outpatient. Pediatric forms out of all this, out of all the number of burn patients, pediatric forms about 60 to 70% actually. And most of the cases of pediatric population pula is due to hot water burn. Now, because of this scenario, so then you look into what are the causes of burn injuries. Now, the causes of burn injuries can be divided into 5 types. So you have a thermal burn. Thermal burn is because of harbor or heat. So thermal burn, and then number 2 you have what we call as chemical burn. So chemical burn is because acid and alkali. And number 3 you have what we call electrical burn. And then 4th category is the radiation burn. Now thermal burn itself can be divided into 2 more types, which is actually because of fire and because of hot water. So this goes back to what I said earlier. In pediatric or in child population, most of the burn injuries is because of the thermal burn, but in the scald or hot water category. That's how we look into this demographic of burn injuries in Malaysia. So now usually when we talk about burns, we always hear people say first degree, second degree, third degree, fourth degree. Now how do you come to this classification is mainly on the depth of injury. But there's a more accurate way to actually define burn depth, which is in medical terms here. When I give talks and all that, we are trained to see burns in terms of superficial burns, a partial thickness or a full thickness. That means superficial is just the outer part of the skin involved. The full thickness is the whole skin involved. Partial thickness is in between. Now, when you have partial thickness, then you have superficial and deep partial thickness. So how do you classify? Now, first, in the type of superficial burn is when the skin is not involved. Meaning that you have what we call as sunburn, for example. You go to the beach, so you got a sunburn, but the skin is still intact. So this is called a superficial or first degree burn. Now, there's a reason why we use this type of classification. Second degree burn or partial thickness burn is when the skin already involved. The most easiest example is, sometimes when as a childhood, tengah nakal-nakal and all that, so naik motor tak ada lesen, then kaki tu hit the exhaust, and then you become like a blister tu. So even though the skin is intact, but because there's a blister, so the skin is already elevated. So this is already considered sebagai partial thickness burns. Understand? So you have superficial and partial thickness burns. So that means partial thickness is second degree, third degree onwards. The most severe is fourth degree burns, where the whole thickness sometimes involving the muscle and bone involved. Now this is important because when we communicate between medical centers, for example, you have patients from district hospital, they want to send to specialist center. So in Avisena punya scenario, sometimes we have from Banting, for example, they want to refer to Avisena as a specialist center. The communication must be correct. So for example, if they said there is a partial thickness, we must receive as a partial thickness. You understand? Because the initial introduction or initial treatment will be dependent on that. If let's say here, we got the information is, for example, first degree burn or superficial burn, but in actuality, it's actually third degree burn. The instruction for the first responder treatment is incorrect already. So that's why it must be standardized in terms of how we classify burns. So when we talk about healing of any injuries for that matter, not only burns. So there are a few aspects when you consider whether the wound is healing or the patient is healing or not. So how we look at it is, first you have what we call as a physical healing. Number 2 is what we call as a psychological healing. The psychological part is when you talk about the emotions. Sometimes patient even with major burn injuries, they have what we call as PTSD. or post-traumatic stress disorder. So they have this psychological effect of burns. So sometimes they might go into depression. So this is also considered a very important aspect of the healing process. So if you don't treat this properly, even though patient have a good physical healing, but the psychological or the mental well-being is still not corrected. Now, on the physical part itself, when you talk about pediatric or childhood compared to adult, also it's different because the physiology or the body response of the pediatric population is different for adult. All systems, we're talking about whether it's cardiovascular or whether it's a renal system or respiratory system or even the neurovascular system. So all this is different from adult because pediatric or child, they can deteriorate very fast. So sometimes patient that comes with a minor burn, I have seen actually one case was referred to the center that I worked before I joined Avisena in the government hospital, but it's a very huge center. It's a referral center for Malaysia, which was Hospital Sungai Buloh. So we got a referral from another district hospital, but this is actually a 5-year-old girl. She actually had a hot water burn from a spill of bihun soup. And what happened is the child actually died. The child actually passed away because of a simple hot soup injury, and this is because of the infection that sets in, and then finally it affects the other cardiovascular systems, the kidney shut down, the heart shut down, and even the brain eventually shut down, so patient passed away within a time frame of about 3 weeks. So that's why I said even for burn injuries, for pediatric and adult it's different because of the response of the body to major burn injury. On the other hand, if let's say you treat properly and you can actually prevent this, we have seen a few cases even in Avisena that the outcome is something that you don't expect. So patient came with very bad facial injury, and then the parents are crying and then all that. But after 3 weeks, they are smile again because the scar actually is as if they have never had burn before. But the key is how to identify the agents, how to treat in a timely manner, and then eventually you can get the result that you want. Adult, on the other hand, is a bit different because sometimes, even though their response is more controlled because the system are well developed, but they might have comorbidities. That means they have other diseases. For example, they have diabetes, hypertension, heart disease, kidney disease, which can again affect burn punya status. So again, another type of demography and another way to actually look at it. See, when you talk about reconstruction of the skin, also again, you have to look at the big picture. It's not a matter of all burns we do for reconstruction. In fact, nowadays we have technologies that there's a shift in the paradigm of burn treatment, where we don't usually go for those days. Burn means that daily dressing. Sometimes patient comes for 2 months, 3 months, dressing every day until they become center, not more center in upstairs because of so much stress. But nowadays there's a shift in the way we treat burn patient. So we have new technologies like what we call as stem cell therapy. We have biomodulators. So we have even serum therapies that can actually assist the body to recreate the cell without us doing anything. So we have that. So for example, we have an area of burns over the leg. You can actually use these growth factors in combination with a stem cell that can actually stimulate the body to multiply the formation of new skin. So eventually the skin will close by itself. Now, having said this, there are certain type of cases that you cannot use this technology because, for example, the wound is so big or huge and you cannot afford the time to wait for the skin to regenerate. So because if you wait for too long, the wound, there's a risk of infection that sets in and all that, or water losses that can actually harm the patient. So in view of this, you need to go for procedure where you actually cover the area in terms of skin coverage. So now the decision to do skin coverage, again, we look into a few aspects. So number one, of course, how big is the wound? So if the wound is so huge, so is the body enough skin for us to harvest? Do you know that the gold standard to harvest the skin in the body, where you don't get any scar, is doable? You can take a skin, but you cannot see any scar. Do you think it's doable or not? Because you do a small wound, macam luka sikit pun, there will be scar kan? But there's a way that you can take which no scar at all. If I say this, do you believe me or you think I'm
You're specialist.
Yeah. So the gold standard is taking from the scalp. So we shave the head and then we can take from the scalp many times. After 2 weeks, you can take again. So the scalp will grow hair again. You won't see any scar at all. So there's a way that you can do that, for example. But then again, sometimes there's also a technique where if there is not enough skin, we can actually take maybe about 1 centimeter square of skin, and then we can grow in the lab. So it's like grow in kandang kulit. So then the skin will be a lot, and then you can put on the patient. So that's one factor. So another way is look at it is which area. So for example, if the burn area on the hand, palm, compared to burn area on the chest is different because the skin quality is different. So this is a different type of skin. This is called glabellar skin. This is a normal other part of skin. So all these other factors that we decide. So when you have big area burns, of course, let's say for example, you have a 90% burn that involve multiple area of the bodies, then there's no more skin to do. Sometimes some patients ask me, family members, they're very concerned. Doctor, can we donate our skin? So we want to donate our skin. Unfortunately, you can't. You cannot donate your skin because the skin will be rejected. You can always use your own skin. Now, but on the flip side, you actually can harvest a skin from the same area multiple times. So what you do is after 2 to 3 weeks, the skin will regrow, and then you can take the skin again. So when we do this is called a split thickness skin graft, meaning that there's a skin, we slice the skin, not the whole skin. So we slice. So when you take about maybe 1/3 of the skin, the 2/3 will regrow, and then you can take again. So this is one way. So how we prioritize, it depends on, for example, the critical area will be covered first. If patient have area, for example, like involving the neck, or the chest, and for the hand, so we will go into areas that, number one, when there's a vital structures exposed. For example, if there is a heart exposed or there is a big vessel exposed, that will go into the priority first. And number two, when there is a potential scarring that can actually cause a compromise in terms of the function. For example, if you have burn over the hand, if burn over the elbow compared to burn over the forearm, it's different because the elbow will go into movement later on. So there's a scar here, this will be a disturbance in the function of the elbow. So if you have this whole hand, priority will be grafting on the elbow first. So those are how some of the things that we can do to cover. Okay, the long-term care of burn patient, again, when I say, as I mentioned earlier, when you talk about healing, you look into the two aspects. First is the physical part of it, and then number two is the psychological part of it. So when you talk about holistic approach in terms of burn care, you must look into these both component. So first, when we look into the psychological part of it, so the psychological part is you must look whether the patient has actually recovered from the psychological trauma. So if patient actually still have that trauma, so patient might need to be referred to maybe a psychologist or even a psychiatrist. And then of course we will look into the family support and up to the community support if it goes to school and all that. So this is very important so that the patient can actually go through from the state of being in shock and to have a functional emotional system back. But if let's say the patient still have a lot of trauma that doesn't resolve, so they might actually need to go a proper therapy. In terms of the physical part, of course, sometimes when we see in our center, let's say a specialist center, when we talk about burn patient, we usually accept two types of patient. Number one is the acute care, where the patient comes immediately after burn injury. But number two, we also see patients that come after being treated somewhere else. Sometimes I even have a patient who came all the way from Indonesia, was treated there, and then developed a very bad scarring. So the patient actually traveled here every few weeks with the parents. This is a small child for the treatment of the scar. So this is the second cohort of patient that we see where they actually come with a complicated scar. They are still a burn patient, but they don't come in acute stage, but they come in a more delayed or more later part of the injury where they already form a scar. So this type of patient, the treatment is in terms of the management of scar. Management of scar, again, very specialized. So you are talking about scar reconstruction, which comprises of surgical and non-surgical. Surgical part is the surgery that we do. The non-surgical part is we do things like laser treatment. We have even injectables and all that. Even compression garment, when you use for burn patient, also consists part of the treatment for the surgical scar. So that's how we approach for long-term type of burn injuries. I think if you want to answer that question, you must look into most of the scenario that we see. So then only you know what are the type of cases that we usually see. Now, when we talk about pediatric population and adults, slightly different. For pediatric or children, as I mentioned earlier, a lot of it is because of hot water. Now, hot water ni unfortunately is because of the instant water dispenser at home. So this is the most common culprit that we see nowadays. Because child, they can actually go there and then they just press and they to splash on the face. So I think the preventive measures is probably to look into this type of machines, how you actually want to double lock it so that it become child proof. Number two, of course, is we also see where the child goes into the kitchen and a hot bowl of noodle spill onto the child. So this is the second most common presentation that we see lah. So unfortunately, there's no shortcut to this lah. Cumanya the parents maybe need to be more careful at home and then prevent this from happening to the child. Of course, sometimes you also see from charger cable, macam handphone charger and all that, where the child actually chew and then they got electrical burn. So again, preventive measures. In adult, I do see a lot of cases where they actually had chemical burn. In fact, I just did a surgery maybe yesterday. Chemical burn at home is usually from the solvent that we use to actually unclog the sink. So this is the most common type of chemical burn that we see. So when you see there's a clogged sink, they put something inside. So this actually build a lot of heat, and the thing will actually burst suddenly and hit the patient. So usually they have to be careful about all these types of burn injuries. I think in terms of awareness, so the ministry is doing a good job in terms of doing a lot of public campaigns and also to do a lot of courses and leaflets to give to the public. Cumanya, I think there's still loopholes in terms of we can actually improve more, probably by doing more campaigns. As I mentioned earlier, is they need to understand what are the potential causes of burn and how to avoid it, and if it happens, what are the first preventive measures that need to be done. For example, let's say we have a fire burn. I mentioned that you need to run underwater for probably about 5 minutes, and then you can actually minimize the injury. However, if you have chemical burn, you cannot run for 5 minutes. You can make it worse. So this is something that I think a lot of people are unaware. So let's say we have patient with chemical burn, we actually bring the patient underwater, and then we run for 5 to 10 minutes. It actually make the burn worse because the chemical reaction will create more heat and cause more damage. So for chemical burn, you need to run for at least 45 minutes to 1 hour. So there's no rush to bring to the hospital, but instead run under a longer time of running water. Again, another aspect that is also important is you cannot use ice water or very cold water. That's another thing. So a lot of patients are not aware of this because the most comfort thing to do is put under ice. But what happens is when you put under ice, the ice is very cold, so the blood vessel will become constricted around the burn injury. So the vasoconstriction of the blood vessel will actually trap the heat more. So instead of actually dissipating the heat, you are causing the heat to become more concentrated and you are causing more injury. So these are small things but very relevant for us to actually disseminate to our public to ensure that the injury actually doesn't become worse. Faisal Halim ni is actually a special case. So I think for me as a fan of Malaysian football, I think we beat Vietnam 4-0 is a good news. So Faisal Halim is a player that I really admire. So when he first came last year, he actually came from another private hospital. So the injury was actually quite bad. So it's a quite severe burn. In fact, when I asked around, a lot of plastic surgeons, even the consultants that time, they said there's no way he can play football anymore. So the recovery that he has is, as what FAS told me, It's the first such case in the world that they can actually play at the highest level again. Tak pernah ada. I have treated a few types of injury similar to him before. I think the seven cases, very bad injury, including him will be 8. So all the 7 cases all was blind. He was very lucky that he's not blind because the injury was very close to the eye. So and then in terms of the damages that he sustained was so severe that he actually lost quite a significant amount of muscle. So actually if you look at him, most of the muscle actually is gone, but because he's an athlete. So you know, when he was admitted to our center that time, he was so eager and was so enthusiastic to recover. He actually, during the recovery in ICU, he ran from the 6th floor to the 1st floor for his training while in ICU. You know, do you know that? He was running and was followed by our physiologist. Our physio officer cannot catch up with him. So fit, and then he was in bandage. He ran up and down, 7 floors. I cannot even run 4th floor. So because of that fitness. Now the injury that he sustained was so bad, then we actually did a few things. Like I mentioned, chemical burn is the worst type of burns that you want to happen, because you only have, because when you have chemical burn, you have 2 types of burn, actually 2 in 1. So first you have the chemical reaction that causes the acid or the alkali to actually causes damage to the skin. And number 2, you have the heat generated by this chemical reaction. So there is a heat burn, there's a chemical injury. So these are 2 combinations of injury. Now when you have chemical burn, the worst thing it can happen is the chemical agent will be there for actually quite some time. So it will be there for at least 2 weeks, 3 weeks, even 1 month, even 2 months. What happens when you have a chemical burn? The chemical agent is there. You have, let's say you have a fire burn. So the fire burn, worst can happen is once we have get rid of the fire, the heat, the wound actually been dressed and it's already quite clean because there's no more agent there. Now you can go for the next stage where you can do reconstruction. But chemical burn, the chemical agent will still be there. So you cannot go for the next stage. I've seen cases where chemical burn and then because of the patients actually deteriorating, we have no choice. We put a skin on it, take it from the whole thigh. The skin that we put also become dead. Back to square one. So you imagine the amount of pressure that we were under that time, because we were in the spotlight the whole world. Now and then, so what we did for Faisal Halim, because of the chemical burn, so we need to actually use not an artificial skin, but human skin, but from somebody else. So the skin is available only overseas. At that time was in Belgium. So we need to actually import that skin to come to Malaysia and then to put on his body as soon as possible before the acid goes in. So you have maybe a window period, a short time. Usually the process for the skin to come from Belgium to Malaysia takes about 2 weeks. But the time that we have is 2 days. So whatever by hook, by crook, you need 2 days the skin to come to Malaysia, it happened. I think there's some background works going on because there's a lot of powerful people involved to help. So it came in 2 days time and then we use. So once we have used the artificial skin, what we call as substitute skin. So that substitute skin costs about, I think, 40,000. So we only use it for 2 weeks because the aim of the skin that we use is to get rid of all the acid. So once we have done that, after 2 weeks, then we can go for the next stage, which is to reconstruct the skin. So the reconstruction again goes into a lot of procedures. So we use a lot of modern techniques. We use stem cell, and then we use a special type of serum, and of course we use a skin graft. And then again for the face, the scarring was quite bad, so we also did a few other procedures like lasers and all that. So all in all, actually, his recovery too is as what we expected from the beginning lah. Cumanya awal-awal dulu a lot of people was very skeptics because I can understand that. I mean, the amount of injury was so bad. You can't imagine that you can actually play back. But I think the credit really not goes to us, but of course to Allah Subhanahu Wa Taala because of his power. But again, also to him, to Faisal Halim, because you can do all the magnificent physical thing, you know. You can do all the latest technology for the skin graft and all that. But if his mental is out, if mental is out, if he's so depressed or he have this trauma, especially in football, You see, when he was attacked, somebody came from behind and threw an acid. If you are playing football, you know, it's a very hard and rough game. People come from behind and tackle you. So that thing can come in a moment, a flashback. Kan? So the mental part is very, very important, and he has very strong mentality. A very strong mentality for him to be able to overcome all this, and now at the highest level again, within less than about 1 year.